Hi everybody, I am Arup Chakrabarti, Managing Partner of Chakrabarti Eye Care Centre. I am basically a cataract surgeon with a lot of interest in glaucoma, and I am quite interested in teaching. In this connection, we have with us a brilliant young ophthalmologist, Dr. Tarun Arora, and he is on the verge of completing his senior residency at RP Center, All India Institute of Medical Sciences. Tarun, you have created a society called Young Ophthalmologists Society. I think it is a great movement. And what made you think about it, and when did you start it?
So 3 years back, I attended the first American Academy meeting in 2013, and there I interacted with a lot of young ophthalmologists. So they already had a forum called the Young Ophthalmologist Forum in the American Acad, where they had the power to design their own material for the conferences, their own lectures, their own teaching programs, and also they had some legislative authority in American Academy. So I felt that it was a very good initiative that the American Academy has taken, and the same should also be done in India. It started as an online platform where our activities were mainly based out of Facebook, where we started posting cases, we started helping each other, we started promoting academic material. We also started a distribution platform called the YOSI Central, which was a Dropbox application where all the free ebooks, presentations, online material which was put into one place for access to everybody. We started with another application called the YO Assist, where we try to help the people who are in the first 5 years of practice by giving them various offers such as the electronic medical records healthcare system for a free trial, and then by discounted rates by collaborating with various different companies. So that was the basic aim. Our aim was to not only help them academically but also to give a voice to the young ophthalmologist, so as to narrow the gap between the senior people who are the head of all the societies and are taking various initiatives, and the young ophthalmologists who have various concerns, so that they could be addressed in those forums.
Now what are your further plans? Now I think you are working extremely well in the northern zone, Delhi, the area around Delhi, and those adjoining states. But how do you plan to reach out to other zones? For example, my state is Kerala, yes. Or let's say in Tamil Nadu. So how do you get everybody involved and make them part of the whole system?
So currently in last 3 years we have now around 1600 members in our society, which are from all parts of the country. We have a lot of members from Kerala. We have now identified some active members from various state societies. So in the last 2 years we have done that already. We have done that job. We have already seen what all activities are benefiting young ophthalmologists. Now we plan to further expand by giving leadership opportunities to active young ophthalmologists from different societies, giving them key roles so that they can initiate this movement at their own state level societies, and also get more people to be involved in national level activities. So that is our next plan.
Today we have a large number of young doctors coming out of their post-graduation program, and it is a feeling amongst them and amongst many that everybody has to go for a long-term fellowship in different subspecialties. It is very difficult. The number of seats are limited. So I see the need for some alternate training program for those who cannot be accommodated in these fellowship programs, or those who for some reason or the other don't have the time for joining for a long-term program. So do you have any plans for them, and how to help them out in getting established in life in ophthalmology?
So the first thing should be that the fellowship program should be accredited by AIOS. There should be some forum where these fellowship programs have a basic minimum training which should be given to the young ophthalmologist, a basic salary which should be set, some amount of basic structure should be formed for these fellowship programs. Many times I have seen that a lot of young ophthalmologists, they dedicate 1 or 2 years to various fellowship programs, but eventually don't get any training from those fellowship programs. They are just working as assistants throughout the program, and they eventually finish. And recently a lot of institutions have started a bond program in which you have to work for extra 3 years if you want to get into the fellowship. So some kind of structure has to be started by the AIOS. The AIOS has to, which is a very large body, they have to take initiative. So I have already written a letter to the AIOS secretary and the president so that proper fellowship structure can be done, and more fellowship programs need to be introduced to cater to large number of postgraduate students that are coming out of their training. and this has to be done immediately or in a short period of time, because otherwise as a community the Indian ophthalmology will not prosper the way it should prosper.
The term young ophthalmologist, I mean, see, ours is a profession where we have to keep in touch and evolve all the time. So by that definition, from that sense, we are all young. But in reality, when do you have any cutoff point? I mean, young ophthalmologist cease to become a young ophthalmologist in the context of this organization beyond a certain age?
So as per our guidelines, we have set the basic concept is the residents who are either in the residency, or the people who are in the fellowship program, or the ophthalmologists who are in the first 5 years of practice, because all our goals are targeted, all our activities are targeted to the working towards them. So that is basically our the main members of our society. The cutoff age which we have kept is around 40 years, because we think in that age almost all of these people will get catered to. So above 40 we are not planning to do anything for their work, but the cutoff will be 40.
Yeah. So I think that is fair enough. Another question that comes to my mind is, now do you plan to have a bifurcation where we have a special scheme for the ladies in our profession, and a different scheme, or maybe more all encompassing scheme for everybody? Because ladies in the profession, they're brilliant youngsters, they have issues, certain other issues which have to be taken care of. So have you thought on those lines?
Yes, sir, I've had thought on those lines, and a few days back only I've discussed with Dr. Mohita, who's the secretary of Women Ophthalmic Society, that we can collaborate in a manner in which the young ophthalmologists among the Women Ophthalmic Society, they can be given, we can have some special programs for those of them who, because of some reasons, have to cut off their career and have to put some time into their family life. So how we can motivate them to come back in their working schedule, and how to get them back to do further training and reach further major goals in their ophthalmic career.
So Tarun, is there any time frame that you're looking at? Because I mean, sooner or later we're going to be touching 40. All right, it is inevitable. So do you have any time frame, that these are the targets you need to achieve within this period of time, and then this is the next step and next step? Have you thought it out in that process, in that manner?
Trying to work it out in a 2-year manner. So we have already registered our society, and so my tenure as a general secretary will also be of 2 years from now. So I have to, whatever work I have to do is, because a time limit, as you rightly said, is very important to decide. So for all the work which I have done, all my initiatives, and I have decided a period of 2 years in which I will complete all my work, and then will hopefully pass the legacy to somebody else who can have even a bigger vision and maybe decide for what has to be done in the next 2 years. So for myself, I have decided a cutoff of 2 years, after which I will be doing a mentorship role, and will give this initiative to other people to carry it forward.
You did mention that there are about 1,600 members at present in this organization. Can you give us an idea about how many young ophthalmologists are there in the country? I mean, how many of them you need? How many more you need to enroll? What is your overall access that's going to be?
So basically, in that sense, I have never seen the number as a target. So I have never seen. I just mentioned because that is a fact, but I have never tried to achieve a number that we have to grow in number wise. That is not my idea. Number is never a target. The target is quality programs which we can do for young ophthalmologists. Even if we benefit 500 young ophthalmologists, or maybe 100 in some real manner, then that will be more success for our society than to just keep on increasing our number and not doing any activity or any fruitful activity for them. To be very frank, I have never analyzed what is the number I have to achieve. I have never seen what number we need to target. My whole purpose is to give the benefit to maximum number of people which are part of our group, who have the faith that this platform can give a better teaching to them, a better career to them, and can raise the level of their ophthalmic work.
Wonderful. I mean, I will talk on behalf of my state, Kerala, but it applies to all the states. Now, the young ophthalmologists who just passed out of their residency programs, all right, and they are on the lookout, there are various career options. So, how can Young Ophthalmologist Association help them out? Because many of them are confused, there are so many things to be done, there's so many precedences their peers and their seniors have, left behind. So can Young Ophthalmologist Association come to their help from this perspective?
Absolutely, and that is, I think, one of the biggest reasons why our society has been a success over the last 2 years and why the membership is growing is because the people are getting to communicate with each other. They are getting to know each other. It's a good platform for people to interact. A lot of young ophthalmologists who join our society, they get into touch with a lot of fellows who are already doing the fellowship. The fellows get in touch with people who are already finished their fellowship and now into practice. And this kind of interaction is what helps each other, all the person to help each other. So I almost get a message every 3 or 4 days about people asking about what are the good fellowship options in cornea, what are the good fellowship options in retina, and then I make those people get in touch with other people who are already into the fellowship. They get to communicate, they get to understand they get real expectations out of a fellowship program rather than having some imagination. They get to know what exactly they're going to do over that 2-year program, whether it would be in line with their future, whatever they dream of doing, whether it will be in line with that or not. And also for the people who are finishing the fellowship program, if they are going to join private practice, it gives a very good option for them to get into a group practice, because knowing more people definitely opens up your options. And these days it is very difficult for a single practitioner to start a practice and then go into competition with other corporate hospitals. So this is, I think, is such a fruitful opportunity for people to grasp, and this is because I myself see so many people getting the benefit, and I think that is the main reason why our society is continuing to grow.
Have you taken any tie-up with, let's say, All India Ophthalmic Society or IIRSI, so that you have dedicated slots during the All India conferences or during the Indian Intraocular Implant conferences and similar major conferences like DOS meetings or the state association meetings? I mean, we have from October to December we have more than 25 to 30 state association meetings going on. So have you ever thought about having a wing, the state wing will conduct a program, and for those who cannot really attend the program on a bigger scale, on a national level, so they can still be in, let's say, in Kerala, or they may be still in Tamil Nadu, but get full information about the kind of discussion that we are having.
So we have already collaborated with a lot of societies. Like we first started with the Delhi Ophthalmic Society, then we went to the Jaipur Ophthalmic Society. There we had a young ophthalmologist session. We had a young ophthalmologist session at AIOS, and for now we are having at Trivandrum. So we are slowly, this whole feeling of having a young ophthalmologist society is itself growing up in people who are organizing these conferences, and that is a good part. Even without telling or asking them for organizing such a meeting, a lot of people are themselves taking initiative. So one thing I'm happy about that. Second thing, I realized that the benefit which we get from having us like a 1-hour platform in these meetings is not that much as we can have in our own meetings, because there we can really have a very good scientific program in totality for the whole day, in which the young ophthalmologist can benefit. But I agree with you that if we have it at one place, I also felt the same, that the young ophthalmologist cannot travel that much. So my vision is to have all the now major sessions as a webcast. I feel that everybody is connected online, and if we have good webcast sessions and which are very detailed and very informative, rather than having a small 10-minute lectures, if we have a topic, let's discuss about it for 1 hour. Let's have a good webcast on it. Let's show a lot of surgical videos, and then that is how I want the society to go further, rather than having small sessions which I did not find to be very that informative, which I thought that they would be. I feel that is the direction I plan to go.
No, I think I mean, you are right in a way, because today most of the learning is web based.
Yes.
So I mean, it is not necessary for anybody to travel the physical distance, and everything is available on the net. From another perspective, few of us, those who have crossed that age limit but are still actively involved in teaching in various programs, for the postgraduates, residents, and in major conferences. So what can people like us do to help you out, to make you realize your dream in a more significant manner?
So sir, in most of our programs or the sessions we have done, we always want the senior ophthalmologist to be a part of it, because we realize that the whole wisdom, the whole knowledge, the whole experience is with the senior ophthalmologist. And without them, all our sessions would not be that fruitful, or we would not be able to gain that much. The only difference is that here the plan of the session is slightly different. The plan is, in normal meetings, what happens is senior ophthalmologists come and they tell what they feel would be beneficial for the young ophthalmologist. Our meeting is the opposite way around. Here the young ophthalmologist comes and asks that how should I do this, how should this be done, and we want the senior ophthalmologist to guide them. So it is not that we don't require or we don't see senior ophthalmologists participating in our meetings. They are the most vital part and the crucial part of our meeting. And the meeting which we did last year, we had almost most of the senior ophthalmologists come there. But the difference is that the way the session is planned is totally different from the sessions which are held in most of the conferences, and so that is it. The other thing which I think the senior ophthalmologist can do is that they can also, the senior ophthalmologists who are working in private practice, they can help the young ophthalmologists who are coming new into the practice by doing some kind of meetings for them in terms of how to set up a practice, inviting them to the institute to show them how things can be done. So it kind of a environment which is more friendly environment can be built up, because the people who are having big practices, they should not feel them as a competition, because the gap is too much. A young ophthalmologist just starts with a practice, he cannot compete, but a comfort zone should be given to the young ophthalmologist to work that out, I think.
So Tarun, I think it is a wonderful initiative, and I really appreciate and really congratulate you on your vision. Now I just wanted you to any message for the young ophthalmologist, something that you would like to tell them, those who are watching this webcast or this program, any message for them, how to take the message forward from here?
I think for the young ophthalmologist, the main message would be just pursue your dreams. Don't think that anything is going to stop you or come in between you and your dreams. Make your vision bigger and bigger, and ultimately the bigger your dreams, the more you are able to achieve, the more our Indian ophthalmic community will rise in the world. And for everything, I think the Young Ophthalmic Society is there to as a bridge to help you in whatever sense it can. You can always communicate to our society, you can always get in touch. We are always there, and that is our purpose, is to facilitate your dream, but ultimately it is your dream and your vision which is going to take you to heights. So don't stop dreaming, show your passion, dedicate yourself to your work, and rest, I think if you do that, everything else will fall in place, and everybody else will be ready, more than willing to help you out.
Yeah, thank you so much, Tarun, for elucidating what your goals are and what your plans are for the future. I think Indian ophthalmology today is in very safe hands. There we have a very vibrant group of young ophthalmologists, young surgeons, who are attending most of the meetings, talking in the meetings, getting awards. That is something that is happening, which never happened earlier, and I'm talking about more than 10 or 15 years earlier. So basically, I think we need to encourage this group. We need to mingle with them. We need to find out in what way all of us can help them, so that Indian ophthalmology eventually progresses and becomes, one of the topmost societies in the world. Thank you very much for listening to us. Thank you, Tarun.